Good morning, everybody. Welcome to our first of 5 Walkinars, hosted by the Maryland Department of Transportation in partnership with the Maryland Department of Planning, held on Thursdays during Walktober, a month-long series of activities and educational events to promote safe walking and walkability. My name is Joe Griffiths with the Maryland Department of Planning, and I am serving as the moderator of this Walkinar session. The Maryland Department of Transportation works to advance transportation and land use planning with the goal of supporting vibrant communities, promoting safe transportation options, and connecting all Marylanders to opportunities and to each other. In May, MDOT launched their monthly MDOT in Motion educational series. MDOT's Walktober Walkinars, including today's, align with this series, which brings you timely and important information about active transportation and mobility topics. Please note that this webinar is being recorded and will be posted, along with past webinars, for viewing on MDOT's YouTube channel. Other valuable information on statewide planning initiatives, planning tools, and educational opportunities are also available at mdot.maryland.gov. We encourage you to visit the Office of Active Transportation and Mobility's landing page, where you can subscribe to our e-newsletter to learn more about our upcoming programs. And finally, it is important to note that the views expressed by the speakers are those of the speaker and not necessarily those of the Maryland Department of Transportation, the Maryland Department of Planning, or the state of Maryland. Now, to kick off today's program, we have a special welcome from Maryland's Acting Secretary of Transportation, Samantha Biddle.
Thanks, Joe, and good morning, everyone. I hope that everyone had a chance yesterday to get outside and celebrate Walk Maryland Day. I was able to join with colleagues at the Port of Baltimore for a stroll around the Inner Harbor to go out and enjoy what was really just a beautiful morning. I also got to go out on a local trail near my home later in the day, so I felt like I celebrated appropriately. And I did have a chance to look at photos from events across the state. Really wonderful to see everyone getting outside, getting together. But on behalf of Governor Moore and Lieutenant Governor Miller, I am thrilled to be here this morning to kick off this year's Walkinars. Thank you so much for joining us. And I want to thank our partners, the Maryland Department of Planning, the Maryland Department of Health, State Highway Administration, Maryland Highway Safety Office, America Walks, and of course, AARP. Also, of course, need to give a shout out to the Maryland Department of Transportation's Office of Active Transportation and Micromobility, Director Candice Holford, Deputy Director Meg Young, and Multi-Modal Transportation Project Specialist Francine Waters. They've worked to put on a great series of Walkinars this year, while also working diligently in the background to implement MDOT's Complete Streets statewide that prioritize the safety of those who walk, bike, and roll. The Maryland Department of Transportation is serious about safety, and this means saving lives and ensuring everyone gets to their destination safely. We're doing this by prioritizing safety in everything we do and making strategic investments to improve safety. More than $537 million in our draft 6-year capital budget is dedicated to bicycle and pedestrian projects. That includes more than $240 million for constructing these projects, and this is the largest investment in active transportation that I can personally recall. MDOT is making great strides to prioritize the safety for all road users. This year, the department's Complete Streets policy went into effect. It applies to all projects on MDOT property and ones that are funded by the department. The policy puts safety at the forefront of vulnerable road users and prioritizes their safety during each phase of a project. Last month, MDOT announced more than $8 million in grants to expand safety through bicycle and pedestrian infrastructure projects across Maryland. And the department also released our new statewide trails strategic plan. The plan establishes a bold vision for safe, accessible, and connected transportation trail network that supports communities across the state, linking people to jobs, schools, parks, transit, and each other while enhancing safety, sustainability, and quality of life. I encourage each of you to check it out. These are just a few ways MDOT is leading the way to make this Maryland's decade and make sure we're leaving no one behind. We're already seeing the benefits of this work. Deadly crashes are down year over year. And so far this year, Maryland is also seeing a decrease in the number of pedestrians and bicyclists killed on our roads. but we know that there is still work to do and more lives to save. So we urge you, our partners, to join us as we strive to provide the safest transportation network in the nation. Maryland is a Vision Zero state with a goal of eliminating all vehicle-related deaths and serious injuries on our roads by 2030. Thank you so much for being here and listening today. I encourage you to join us for all of the Walkinars this month as we will share resources, new tools, and technologies that will help improve walkability. Each and every one of us has a role to play in keeping Maryland safe, and by working together, we can sharply bend the curve to zero. I hope you all have a safe and productive Walktober. Thank you.
Thank you, Acting Secretary Biddle. It means so much to have the support of leadership, which demonstrates how important this effort is to your agency and to the state. Now, before I introduce our speakers today, we have a short video to thank the legacy partner that we're highlighting today, AARP. Let's take a quick look at AARP's involvement in Walktober and their efforts to promote pedestrian safety.
Now what? We'll go for a walk. What? A walk? When I'm walking. Yes, I know I'm gonna be the man who's working hard for you. But I would walk 500 miles and I would walk 500 more. To be the man who walks 1,000 miles to fall down at your door. Gents, take a walk.
And thank you for allowing us to have a little bit of fun there. Right. Give me a second. Yeah, and thank you to AARP for your unwavering support throughout the years. We couldn't do it without you. Let's see, let's get to a little housekeeping here. Following the presentations, our presenters will answer as many questions as time permits. You can submit a question for the speakers at any time by using the Q&A tool located in the control panel at the bottom of your screen. If you have administrative or technical questions, please use the chat function. But I do request that you please add your questions to the Q&A tool and not to the chat, as we'll be much more able to readily access the questions at the end of the Walkinar if they are in the Q&A tool rather than in the chat. AICP certified viewers of this live event are eligible to receive 1.5 CM credits from the American Planning Association. To receive AICP credits, visit the APA's website, planning.org, log into your account, and search for the name of today's event, or search for event number 9317960, which you can see on the screen right now. We have an exciting lineup of expert speakers today. First, we'll hear from Mike McGinn of America Walks. Mike, him, got his start in local politics as a neighborhood activist pushing for walkability. From there, he founded a nonprofit focused on sustainable and equitable growth and then became mayor of Seattle. He has always worked to add new voices to city decision-making and has gained deep insights into how influence is gained and wielded to make change. Just before joining America Walks, Mike worked to help Feet First, Washington State's walking advocacy organization, expand their sphere of influence across the state. He has worked on numerous public education, legislative, ballot measures, and education campaigns, which has given him an abiding faith in the power of organizing and volunteers to create change. His many years of advocating for sustainable cities and environmental justice give him perspective to expand America Walk partnerships. Welcome, Mike, and thank you for joining us today.
Thanks, Joseph. So why don't I launch in? Excuse me, all. So it turns out that I am the very first speaker of the entire series. So I feel like I need to start with and I apologize if I show anything that all of you know before, but at America Walks, it's like, man, what if you had an answer for safety, health, economic vitality, household expenses and affordability, um, community, a sense of community and belonging. And we're sitting here going, we got it, walkability. So America Walks is, let me make sure my slides are rolling. We kind of have two primary missions. Our first is to support local advocacy for walkable, accessible, and equitable places. And that local part really matters. And we're also work to be a voice for walkability at the national level. And the reason I say the local advocacy is so important, while the national news can and does, lead the news and maybe lead what you see on social media. There is so much that can be done. There's so much money that is in local governments and state governments that can lead to creating these types of communities that really improve our quality of life and well-being. And you got a little bit in my intro, but I, worked in my neighborhood to organize to get sidewalks. And you know, next thing you know, I was starting a nonprofit and running for mayor. So anybody out there, you can start on the smallest project and you don't know where it's going to take you. So be careful with that. We focus on training and education of local advocates, sort of walking college, educational webinars. We also offer small grants, catalytic type grants to people trying to create change. We also have campaigns. We work to, at very heart of it, building better streets, reconnecting communities that have been divided by overbuilt roadways or highways, freedom to move, looking at the factors that keep people from moving that aren't physical infrastructure. We're right in the middle of our week without driving. There are literally hundreds of local organizations promoting Week Without Driving this week. I invite you to go online to find out more about it. Because we need to focus on the 30% of the population that does not regularly drive, kids, seniors, people without the ability to drive or people without the means to drive. It's a big chunk of the population, and building a system that works for them is building a system that works for everybody. And of course, safer vehicles for pedestrians as well. Let's just take a minute to focus on safety. Good to hear the news from Maryland that fatalities are going down, but we have to recognize that nationally, this is against a decade-long increase in pedestrian deaths. And it really peaked in the pandemic and it's come down a little bit since then, but it's still far higher than where it was, just a decade ago. And we do not, I don't have a slide for this, but you can confirm this yourself. The United States is an outlier. All of the other developed, Western Europe is seeing traffic deaths go down. And other places are managing to reduce deaths every year, as well as pedestrian fatalities. And we're going in the opposite. We've been on a longer term trend, going in the opposite direction. So thank you to Maryland for its commitment to Vision Zero. Um, it's very unequal. It strikes Black or African American or American Indian or Alaska Native at far higher rates than others. It affects people living in lower income areas, and there's a reason for that. And that's usually because those areas get the least safe roads, and wealthier areas get the most safe roads. So I just want to share this. We know the roads where most of the fatalities occur. It's non-freeway arterials. The interstates and freeways, I mean, it shouldn't be that high because there aren't supposed to be pedestrians there, but there are people by the side of the road. Collectors in local streets are not as much, but non-freeway arterials are very high. Um, Here's another slide that shows the same thing, that it's really the arterials where most of the pedestrian fatalities occur. And this is what we're talking about. We all know these streets, a couple of lanes in each directions, crossings are far apart. People may choose to try to cross it, even because the safe crossings are so far apart. It's not logical to walk that far, so they engage in a risky behavior. And look on this street, the sidewalk. There isn't one, but there is a beaten path, probably where people walk. Another example um, of the type of roadway where most deaths occur. Again, I intentionally chose people with pictures with people in them because there are people on these streets walking, even though it's a not a good idea. And really telling people it's not a good idea as a strategy isn't working, as we've seen from the rise in pedestrian fatalities. Um, Also want to talk here. Oh, I think I skipped a slide that I didn't. Okay. Next thing I want to talk about here is health, the benefit to health. And I think I've showed some of these slides in a prior webinar, but I'm going to show them again because it's so powerful. And one of our supporters is the Centers for Disease Control. And they give us this support because of the effect of walkability on fighting chronic disease. There aren't other treatments as effective as regular daily physical activity. And, you know, community design for physical activity. And this is one of the things I really love about Active People Healthy Nation from the Centers for Disease Control is they're not just telling people to change their behavior. They're saying, let's build the types of places where we know people will walk more because it is safer and more convenient. Um, and I'm just going to go through just some of the health effects here. Without going through every detail of this slide, let's just know that we researchers have studied the health effects on people of different types of places, whether they're very car dependent, somewhat walkable, all the way up to more walkable. And again, I'm not going to go through all the details of this, but this is really worth looking at in more detail. I'm sure you'll get the slideshow shared with you. You can look at the environment and travel factors, and you combine that with the behaviors that it creates and the exposures, that one has then, the biological response of the human being to those things and chronic disease. And the data is really clear that walkable places really matter on um, improving the behaviors and improving health. So um, I'll skip those. Here we go. If you live in a more walkable place, you walk more. Okay, maybe we didn't need research for that, but it's proven. And it's not about people's choice. A person that lives in a less walkable place and moves to a more walkable place walks more, and vice versa. And that data holds up over multiple studies. Walkable places create a lot less stress, and stress is a significant factor in creating disease. Reduces heart disease, um, reduces diabetes significantly. And this is the one I like quite a bit. It increases the sense of community. And I think we could all use a little more feeling of community in these days. But this is also a proven issue, which is we recently heard from the Surgeon General about the negative health effects of social isolation. We really are healthier when we're around other people and engaging in those types of human interactions. And walkable places increase that sense of community and therefore improve your health as well. Okay, I said I was going to go through the entire list, and I'm going to be as quick as I can about this and stick to my time limits. Household expenses. People that, let's take a look. The single most, the biggest household expense is housing, not surprising. But second is transportation. And if you build walkable places where people can rely on transit and walking and biking rather than car ownership, they can really save some money. By the way, building more housing in walkable places can also help you save money. We know we have a horrible issue with housing prices. We also know that cities that are and states that are more welcoming of new housing can mitigate those price challenges for people looking for places to live, make it easier for people to live closer to their job or other destinations they go to. So building walkability communities, if we're serious about it, is a serious affordability issue as well. And the vehicle costs are particularly significant the less money you have. If the price of entry to the economy is owning a car, you can see how big a burden that is on lower income people. And the loss of a vehicle then can also be a real barrier to participating in the economy. So if we really care about engaging everybody's participation in the economy and having jobs and having good jobs and saving them some money, yeah, this is a great thing to do. City finances. Okay, this may be more for the professionals, but hey, if you own a property and you're paying property taxes, there's a really simple way to improve the financial health of your city, which is or town or place, which is to add a few people in walkable places. Um, and here is a very small example of this. A guy named Joe Minicozy from an outfit called Urban 3. You should check him out. You know, he does comparisons on the financial contribution of various types of property to the local tax base. And he's in Asheville, so he compared two Asheville properties, but you could do this in your town. Look up the property tax records, figure it out. You think of the Walmart as being a really important source of taxes for your local government, but it also consumes a lot of land. Here it's consuming 34 acres of land. And that's a lot of roadway around it. And, you know, it's a lot of pipes and wires to reach it. There's a lot of infrastructure costs to reach it. Um, and its total property taxes per acre is $6,500. Its jobs per acre is 5.9 jobs per acre. So if you really want to, you know, boost the financial viability of a place you're in, you know, he compares that to a very old 6-story building in downtown. Lots of places have these. And but even a 3-story building or a 2-story building in your downtown would still compare very favorably. 634,000 total property taxes per acre, you know, 73.7 jobs per acre, and a lot less infrastructure because you have everybody, you know, in the center of town served by services. So infill, urban infill or town infill, replacing some parking lots with housing or mixed uses like this, really dramatic difference in helping carry the property tax burden and keep your place up the way it should be. Okay, climate. This is an unbelievable climate tool. I'm going to be really quick on this. Um, Over here on the left is well, I don't actually remember now which map is which. One of these maps is the New York Times climate map, and the other map is the EPA's walkability map. And what do you notice about this? This is Western Massachusetts, a place I'm familiar with. The green places, the places that are best on climate, correspond with the green places, the places that are best on walkability. You can go, and this isn't just true in, you know, a moderately populated place like the Connecticut River Valley. You can go out to a very rural place. This is Wenatchee, a small city in eastern Washington. Same thing. People who live in walkable places have a much lower impact on the climate than people who have to drive everywhere because of where they live. So providing housing in those places can make a huge difference. Um, so I want to speak briefly about this. The value, therefore, of land use reform to walkability. I think we often think about walkability as being about the sidewalks and crosswalks and street design, which it is, right? It makes a huge difference on safety, obviously, and on walkability. But it's also about having the types of places and destinations close to each other so that people can walk. Um, and what we know is that land use reform, according to a study by RMI, can reduce as much pollution as our most ambitious vehicle electrification policies. And that's because there's less driving, there's less stuff. Again, all those roads and pipes and wires, you need a lot less of it to serve a smaller place. You need less materials for the housing itself. And you're also saving trees and wetlands and other carbon sinks that actually absorb carbon and help us mitigate its effect. So I just want to share a few things. When I talk about land use, what am I talking about? Obviously, allowing a mixed use building is one, allowing some housing is one. Um, well, we'll come back to that. Eliminate parking minimums. That's just the easiest one, people. Places that are eliminating parking minimums are reducing the distances between destinations, allowing more small businesses to open because they don't have to find a parking space or set up parking spaces, particularly in town. The places, the centers of towns that have been hollowed out by big box stores out on the periphery, allow people to build new, create new businesses in your core without having to search around to find some parking minimum. Similarly, if you can build housing, You can build housing more cheaply as well. Here's an example just in my neighborhood of Greenwood, Seattle. Behind that wall in the center of the picture is a parking lot. Without a parking minimum, they've turned it into seating. They've really added to the quality of the place. Same here on another corner near me in Greenwood. Eliminate the parking minimums, and now you have just, some tremendous outdoor space to accompany this small store. So this little one-story concrete block building, which some people might have considered blight, is now just an awesome neighborhood amenity because, yeah, they don't have to, they can put their parking lot to something that actually serves the people nearby in a much better way. Re-legalize housing. And I know that we're seeing this around the country, but walk around your neighborhood, you're going to find some great old styles of buildings, and there are new styles that can meet this as well. But just allowing multifamily properties, even if they're just a few stories tall, as opposed to only single family zoning, is huge. And here's an example, again, from my own neighborhood where McDonald's was replaced. This is something I worked on as an advocate back when I was trying to get sidewalks in my neighborhood. I became president of the Greenwood Community Council, and next thing you know, I was working on rethinking our streetscape. So the McDonald's was removed, and this is what we now have, an internal street with housing on both sides. Here's a view from a block further down. What used to be a big parking lot and a big box store now supports this. So we can do this. We can create a more walkable and more walk-friendly place that has places that people want to go to um, in it as well. Allow neighborhood stores and businesses, people. This is something that's would be illegal and is actually illegal under the current code in Seattle. But somebody built a neighborhood store in this neighborhood before it became illegal, and it's a local treasure. Somebody can walk locally to get a few things or to get a cup of coffee rather than have to get in a car and drive. Um, Prune unneeded regulations and processes. We've got a lot of rules that are just, from a different era. Take a look. Do we really need it anymore? And invest in affordable housing. So I'm going to go back now just to one last slide that I skipped earlier. Sorry for scrolling fast like this. And the question we would ask is not just how many places are walkable, it's how many people in your state or community get to live in a walkable place as opposed to being forced out to somewhere else. And we have a new tool on the America Walks Land site, our walkable land use analysis. And I pulled out Maryland here. And what you see is that 11.3% of the people in the state of Maryland live in the most walkable places. Almost 40% are in above average walkable. That's good, above average, but it's not walkable in the way it ought to be. And then look at how many people are in below average or at least walkable places. Now, again, there are going to be rural places, but Maryland is slightly better than the national average, which is a 5. So 5.4 is good, but you're below other states. And I want to come back around to it again. This doesn't require a federal program. This can be done by local people. And um, what this Walktober does is it puts people out on the street to see places and to think about how they can improve them. Doing things like walk audits, connecting with their own local elected officials about what could be different. And people have the power at the local level to make a difference. And I know that one of our speakers coming up is going to talk about that. Well, both of our speakers coming up are going to talk about that. So don't shy away from this and think it's somebody else's problem. There are so many stories of the ability of individuals to get engaged with their own community, which is deeply fulfilling by itself to work with others, to do so. And I think that Walktober in Maryland is just a flagship example. I think other states would do well to follow Maryland's example in this series and in the efforts they're doing to promote walkability, to engage the public in this way. So thanks for letting me kick off the entire Walktober series. I'm honored. Thank you.
Thank you, Mike. Now, give me a second. Now we will hear from Rachel Habash of Walk with a Doc. Rachel graduated from the University of Michigan, Go Blue, with a BA in psychology. She then served in the United States Army as a medical service officer prior to earning her MA in counselor education at OSU. The prospect of utilizing her professional experience as a leader, resource manager, and program innovator while encouraging healthy physical activity is what initially attracted her to Walk with a Doc, WWAD. Now that she better understands the impact of the miracle drug walking and the vast number of people served by WWAD, she's hooked. Rachel, welcome.
Thanks, Joe. Great. Thank you, everyone. I'm Rachel with Walk with the Doc. I've had the privilege of serving Walk with the Doc for the last 11 and a half years, and I'm excited to share that with everyone today. So I've heard it said, many of you probably have heard it said that laughter is the best medicine, but actually Hippocrates said that walking is the best medicine, a physician, philosopher, and my job here today is to convince you that that is true. It doesn't need a lot of convincing if we look at the people who are here. I'm preaching to the choir. So I want to start with walking and heart health. Number of things that walking can do for our heart: reduces the risk of heart attack, lowers our blood pressure, improves our cholesterol, improves our circulation, and reduces stroke risk. If that's not reason enough to walk, I have more. Walking and cancer. It reduces the risk of 13 different cancers. It also can prevent reoccurrence and improve survival rates. I'm going to pause here for a second so everyone can scan over this list, and we'll have these slides available, but this is pretty powerful in and of itself. Walking and mental health. This is probably my personal favorite. Everything from depression to sleep, anxiety, stress. And when we pair that with walking outside, we amplify the effects. So there's so much goodness that comes from walking and moving our bodies that we, again, the people on this call obviously know that. If you go to our website, we have 100 reasons that we've listed out for the benefits of walking. So I encourage you to check those out. We have this flyer, happy to send it to you as well. A number of different resources that you can share to tout the benefits of movement. So our founder, Dr. David Sabger, understood all of these medical benefits of movement. He was fresh out of his fellowship, cardiology fellowship, and he was seeing patients who were presenting with myriad symptoms that they could prevent or mitigate with movement. And so as a doctor, trained professional who understood these benefits, he was like, well, I'm gonna change these people's lives. I'm going to tell them to walk and they're going to do it. And, you know, things will be better. As you can imagine, simply telling patients to move is not enough. And they would come back 6 months later with myriad excuses. And he learned very quickly he couldn't practice medicine that way. He understood he had this, what he coins the miracle drug of movement, and nobody was taking him up on it. So he said to a patient one day, listen, I'm going to go to the park this weekend. I'm going to bring my family. I would love for you to come, bring yours. We'll do this together. And that really got the patient's attention. You're serious. You are willing to give up your Saturday morning to come walk with me. Okay, I'm listening now. I get it. Let's do this. And from there, Walk with a Doc was born. Thankfully, we have thousands of volunteer physicians like Dr. David Sabger who are willing to host walks in their communities and make this possible, to make walking accessible to those who might be intimidated, who are a little unwilling to go, take that first step alone. And so we're very fortunate that we've grown to, I'm skipping ahead. We've grown to over 600 chapters in 48 states, a good presence here in Maryland, and 39 countries. So I want to spend a little bit of time talking about what the anatomy of the walk is. But first, let me just say that, Walk with a Doc does exist to inspire communities through movement and conversation. And it's in 2005 is when David started Walk with a Doc. So we've been around for 20 years and really just beginning to scratch the surface. David's walk takes place on a Saturday morning. And most of our walks, they gather different days of the week. It's really dependent on the community that they serve. But when we bring a walk chapter to a community, they're committed to hosting ongoing events. So at least one walk a month. That doesn't move the needle, but it is a starting point. And we have found through research that if people are participating in Walk with the Doc regularly, they're moving outside of those events as well. So his walk takes place on a Saturday morning. His patients are invited. I would say 10 to 15% of the people who show up are patients, and the rest are community members. Not everyone needs a cardiologist, but he develops a really wonderful relationships with these people who are walking. And so should they come to need a cardiologist, he's a great go-to for them. He kicks off the event by talking for 5 to 10 minutes on a relevant health topic. The topics can be anything such as evergreen material, i.e. the benefits of walking, or the benefits of being out in nature, or it could be something time sensitive. It's October, it's flu vaccine season, so we could be talking about that and everything in between. It's general health information, 5 to 10 minutes, answer a couple questions, and then we spend the remainder of the hour moving. And the charge is really to, you're going to have different ability levels at every walk. And so we are encouraging everyone to move at their own pace and their own distance, but to couple up with a couple people so that they can get that social connection. And then the healthcare provider can jump from small group to small group so that they get more personal time with the healthcare provider. And what I want to highlight with that, with the healthcare provider piece and why, what differentiates us from other walking groups is it's an opportunity to humanize the healthcare experience. So what I mean by that is professionals, healthcare providers, they are meeting the patient as a human being. They aren't limited to 7 minutes in the office with them. They're out in nature, they're walking, they get to know who that person is. And they're not treating a set of symptoms, they're getting to know the person and building rapport. And then vice versa, the participants are getting to know the physician on a personal level too. They're out there in their ball cap and their sneakers. They're not treating symptoms or delivering any sort of health news. It's just casual relationship building and building that rapport. I kind of think back to the like early 1950s, not early 1950s when doctors would make house calls. It's that sort of relationship building that takes place, and it's really beautiful. I mentioned that Walk with a Doc started with the impetus of getting people moving, but it has morphed into these 4 components. So there is also the health education that I mentioned, the physical activity, which again is critical. Ideally, we're walking outside and getting the benefits of being out in nature. Sometimes that's not possible due to climate, but ideally we're walking outside as well. And then the glue for our groups is social connection, just like many groups, right? And we, since COVID came and social isolation and the pandemic of loneliness, this social connection piece is more and more important over time. And so it's a critical part of our programming. So as I share, we are in over 600 communities, and a number of those are here in the Maryland area. I pulled up a map just to show all of the blue pins represent where a walk chapter is located. If you go to our website, walkwiththedoc.org, you can click on any one of those pins. You can type in your zip code. It will pull up walks that are within 25 miles of you, and you can find their schedule and see when they're walking and go out and join them. And I know David is going to speak next about a local walk here and share that experience. But I just wanted to encourage anyone throughout the state. And if you don't see a walk near you, feel free, you reach out. We can do what we can to bring one closer to your area. But just grateful for all the physicians and volunteers, such as the ARP volunteers who make Walk with the Doc throughout Maryland possible. And honored to be here today to share this with everyone. And that's all I have. Thank you. Joe, you're muted.
You're right, I am. Thank you, Rachel. Thank you for that as well. I encourage everybody to check out all the resources available for Walktober this month, beyond just the the Walkinars themselves and really engage with your neighbors and others that are as passionate about walking in it as you. So now we're going to turn it over to David Conway. Thank you, David. David joined the AARP Maryland Executive Council in 2019. I'm supposed to share my screen. Give me a second. There we go. That's better. In 2019, and has since led key initiatives in Howard County, including advancing safe streets and supporting the Maryland Department of Transportation's Walktober campaign. That same year, AARP sponsored his Walking Fellowship through America Walks, which deepened his focus on the importance of walking and mobility for older adults. As a visible and trusted representative of AARP Maryland, Mr. Conway has been the face and voice of the organization's outreach on voter engagement, COVID-19 vaccinations, and healthy living, appearing on television, radio, and social media. His contributions earned him AARP Maryland's Communications Volunteer of the Year Award. Currently, he leads statewide volunteer onboarding and engagement, building strong teams to advance AARP's mission across Maryland. Prior to retirement in 2017, Mr. Conway spent 43 years in surgical device sales with 3 major companies and 2 startups, serving 23 years in senior management roles, including national sales manager, director of sales, and vice president of sales. He was recognized with numerous awards for sales excellence, including multiple regional manager of the year honors. Raised in a military family, Mr. Conway traveled extensively before settling in Columbia, Maryland, where he resides with his wife. A graduate of Ohio University, we got a lot of Midwestern University folks on today. He is a proud father of 2 daughters and a devoted caregiver to his 90-year-old mother, whose example inspires his passion for wellness. He has also contributed his time and support to the Howard County Arts Council. Welcome, David, and the floor is yours.
All right, thank you very much, Joe. And oh, by the way, I will say that my mother just turned 100 at this point. So she has really been the inspiration for me to really focus on walking and the importance of it for seniors. So let me see if I can share my screen. Okay. All right.
David, if you want to switch it to the presentation mode.
Oh, yes, okay.
The little flip chart at the bottom. There you go. Great.
Are we good? All right. All right. So listen, first of all, I'm very glad to be following Mike and Rachel because AARP at a national and state level works with both America Walks and Walk with the Doc in communities across the country. When I became a volunteer with AARP Maryland, one of my first activities was to take a walking college fellowship with America Walks. It was something that was suggested to me as something I could maybe enjoy doing for the summer. And I learned about active transportation issues and really the importance of walking in our lives. And the class was designed to develop advocates for complete streets policies in their communities. But my interest primarily was in the health and wellness benefits of walking. Coming from my background, I recognized how important physical activity really was to better health. And so after the completion of my fellowship, I really wanted to help develop walking groups in my community. And so I focused really on the 50+ centers in Columbia. And then in 2019, I started working with the Maryland Department of Transportation and the Department of Health, really to draw attention to Walk Maryland Day and the Walktober initiatives. One of the things I want to kind of add to what's already been said is how important walking is. And my mother always told me when I would ask her about her longevity, she would always talk about movement being essential. And walking probably is a low impact way of getting movement in. We do this every day, and it is the most popular form of exercise, not only in the US, but in the world. It's the type of exercise that you can tailor to what you require. There are people who walk very quickly, or people who just stroll, but they're constantly moving. I'm not sure if people realize that at one point in the early 1900s, walking was actually a competitive sport in Europe, where, and someone had even said to me that it might have even been an Olympic sport at one point in time. But I think once the automobile became popular in our lives, people started walking less. But it's critical that we move in that direction and continue to walk as often as possible, because as was said earlier, it helps to protect and repair our organs, and it can really slow the aging, of our brains. As was said by Rachel earlier, walking really is man's best medicine. It releases endorphins, the chemicals in our brains that stimulate relaxation. It increases blood flow. It can prevent diseases. And one of the things that we found that during COVID-19, so many people were out walking because many of the clubs and facilities were closed, and they came together really as groups to socialize and get through the difficulties that the pandemic really brought on. It definitely strengthens bones and muscles and increases your energy levels. The stress relief side of it for your psychological benefits is been documented many times, because we often know if you're having a tough day and you're under a lot of stress, if you get out and go for a little walk, go to the park, walk your neighborhood, it absolutely makes you feel better. It promotes mindfulness, and it really does intensify your senses, especially when you're in a park or in the woods or you're out in nature. It has tremendous, tremendous benefits to you. The social benefits, AARP is very focused on social isolation that affects many, many seniors in our country. And this is one of the ways to combat that. The connection to the community is critically important. And it does help to build relationships with people. And it's something that we find that happens oftentimes during the walks that we host. I threw this slide in because it's interesting that AARP as a national organization does tremendous numbers of statistics. And there were several here that I thought I'd bring up. 10,000 steps has always been something that's been bantered around as being what you should aim for. But I think 6,000 is probably the number of steps a day that will improve your overall health. No matter how many steps you actually do, getting out and moving is what's critically important. But some of the stats that came here, like 2,000 steps really is the number of steps that equal a mile, were things that kind of help us realize that that movement and that association is really very, very beneficial to the body. In Howard County, one of the things that we have done here in Maryland is start a lot of walking groups in our communities. And it was interesting because when I started back in 2019 working with the 50+ centers, it has really exploded to now all of our senior centers in Columbia have walking sessions and gatherings during the week. And Walk with the Doc, we have started the Centennial Park, and then we have Lake Killamukundi as well in Columbia, where I think it's the second Saturday of the month, we all get together, and we have grown exponentially over the last several months that we've been doing it. And it's really been a wonderful opportunity for people to come together. And what is interesting is many of those folks have also developed other walking groups within their own communities, with bringing their neighbors out and getting together for the benefits associated with walking. And these are just a couple of pictures of the gatherings that we've had and we'll continue to have. And I wanted to kind of end my my speaking here with a picture of my mom and the fact that she really has been an inspiration for me because she moves on a regular basis every day. And it's something that has encouraged me to basically do the same thing. So I encourage you to walk whenever you can. Take advantage of the beautiful month of October. There is a reason why Maryland picked walking as its official state exercise. We are a beautiful state that has many, many areas for us to get out and to enjoy. So that much I would certainly encourage you to do. So, Joe, I think that's it for me.
Thank you, David. Get back. Okay, thank you to all of our panelists. I encourage you all to turn on your cameras. We're getting to the point for the Q&A. Throughout the webinar, we've been gathering questions from the audience. And I encourage you, we still have time. We got plenty of time here to submit some more. Please submit them into the Q&A box. So we'll get right to them. You can continue submitting questions again through the end, and we'll get to as many as we can until 12 p.m. It looks like we have a lot of time. So let's get started. Let me look at what we have here. Get back. That's not it. Make that full. Okay, Q&A. All right, I think this first one is, and Rachel's walking. Everybody see, right? We're getting the. We're doing the walking during the Walkinar. That's maybe the first of its kind. I don't know. I haven't been involved in these every single year, so maybe it's not the first of its kind, but it's the first time I've seen it. Okay, so I think this first one is for Mike. Since Walmart is a valuable store for communities, how can we limit the excess land use and still allow its existence?
Yeah, excuse me. That's a challenging question because what you often find in a lot of states is that, one town is competing with another town for sales tax revenues. So they think it's a positive to try to get the Walmart in their town instead of the neighboring town, because sales tax revenue does flow to the cities as well as the state when something's located. I would say there's a couple of things. One is don't get trapped into that in terms of subsidizing that land use by, putting government dollars into attracting the Walmart. But I think the other side of that is really doing the things that can help create a vibrant downtown business district. Most communities have a downtown business district. I know that many don't. But even places that were built completely around a car-dependent style can convert their core into a more attractive core by some of the things I mentioned above. One is excess parking requirements, just deaden a core because having a lot of parking lots between your buildings, or we even saw in older towns that were developed on a street grid when it was walkable. Sometimes the business had to tear down an existing building in order to get some parking for the new business. So that's why you see so many parking lots in what used to be an old full town old town full of buildings. So eliminating parking minimums is just huge. Anything you can do to help promote the core of your downtown, make it easier for people to get their permits, get started. And then I would add to that, if you can get infill housing as well around that, basically, delivering the customer base. The statistic I heard, well, I don't have the exact statistic, but let me just put it this way. Before automobiles, it didn't take that much housing density to support a block of neighborhood retail or a local neighborhood core. But as everyone got cars and their range increased, it took a bigger and bigger population to support, your classic downtown business street or neighborhood business center. So adding people within walking distance of your core can deliver the customer base and reducing everything that goes on there. There are other land use tools one could use. One can ban stores over a certain size and things like that. But it gets trickier. I would, and there are reasons to do that too. But I think the main thing to do is really promote the infill of businesses and homes in whatever existing walkable core that you still have that was neglected and in fact were seriously damaged when we promoted all these big box stores up on the periphery.
Thank you, Mike. Let's see. The next question looks like it's for Rachel. How do you promote the event outside of the, I guess Walk with the Doc, outside of the practitioner promoting it? They're thinking about how helpful this would be to people who maybe don't have access to doctors due to financial or resource constraints. Thank you.
Thanks, Joe, and thank you for the question. There are a number of tools that we use for promotion. The physician inviting patients is just one of them. So at Walk with the Doc, we make a lot of plug and play resources that our partnering chapters can put in place. So everything from social posts to press releases, flyers, and everything in between. It's ready-made material that these entities will use to promote Walk with the Doc throughout their entity, be it a small hospital system, a single practitioner, a community partner. And I do want to emphasize that Walk with the Doc is always free for participants. And so there are a number of times that we are in underserved communities with the intention to provide that sort of access. And so it's always free for participants to come out. There's a lot of great publicity and press that we get that helps to raise awareness too. And then I really just want to give a shout out to partners like AARP, who are marketing geniuses and promote events all the time. And so they help to raise awareness and shake the trees and let people know that Walk with the Doc is happening in their communities to elevate awareness and get more people out.
Thank you, Rachel. This question, probably mostly for Rachel, but could be for anybody. In case we are walking and someone feels dizzy or has a stroke or any other health challenges, how can we handle it?
Yeah, so first and foremost, it's always like have your phone, call 911. I just want to emphasize that at Walk with the Doc, the healthcare providers are trained to treat it as if they encountered somebody on an airplane with a medical issue, right? There's no obligation to treat. It's like having your phone, making sure that you're communicating. And so it depends on the severity, right? If somebody's dizzy, obviously getting them to sit down, but you have a healthcare provider on site who can help navigate those challenges.
Thank you, Rachel. This could be for anybody, but again, I think it's mostly probably for Rachel as well. Do you have a partnership with the Red Cross or fire department or physicians?
Every one of our chapters is unique in the community that they serve. And so some of our chapters will partner with their fire department, their local library, Red Cross, YMCAs, and everything in between. And so some communities certainly do have those sort of partnerships in place.
Thank you. Well, this next question, I'm going to ask all of the panelists to take a turn at it. We'll start with David. What do we need to do to start this in our community? David, I'll turn it over to you first, and then we'll go to Mike and then Rachel.
Well, I think that, you can do one of the things that you can really do to get people walking is you can kind of really start with your neighbors, the people that you see, the people that you're exposed to. You can start with your friends that you might hang out with and pick a day and a time to get together and walk in a particular location. And certainly in Howard County, we have a lot of lakes and parks, and we have a lot of areas that are very conducive for walking. And so one of the things that we've done here is connect with people in their neighborhoods and to see if we can develop walking groups based on that interest. And that was one of the things that we were able to do over the last few years, is to start some different walking groups with individual volunteers at AARP that connected with their neighbors. And we were able to kind of give it a little incentive at AARP. We put together some shirts for Walk Maryland Day that we provided to those who participated, and that got people to come out and to get involved. And it works quite well, and it kind of spread, and it's grown over the years. So that would be one of the ways I would try to start something.
Thank you, David. I know shirts always get my attention, so it's a good place to start. Mike, I'm going to turn it over to you.
Sure.
Maybe you can have perspective from Seattle or just a general perspective.
Oh, I think, I think there's kind of there are two very different, there are a couple of different strains here. And one of the things I really admire about David is that he has both strains here, both the community organizing and kind of advocacy strain, as well as just the get out there and let's walk together. They're not mutually exclusive. Um, but if one starting point to engaging people in your community is something AARP supports, and we support them, and we're both big proponents of walk audits. Is there a particularly challenging part of the community? Maybe it's an overly wide street cutting through, where people are present. Maybe there's not an easy pathway to the local park or to the local corner stores. So walk audit sounds really technical. It's really so simple and straightforward. You know, it's a way to get folks out in the community out to take a look at a street. Invite your local DOT folks, invite your local elected officials, invite the local businesses, invite your neighbors out and just say, hey, we're doing a walk audit of Oak Avenue or whatever it is. And you can go take a walk on the avenue and point out all of the changes that would make it more pedestrian friendly and safer and more likely then that somebody would choose to walk to the park or the store rather than drive. Um, School districts, right? What's the access to your school as well is another great example. And those types of things can really make a difference in meeting people face to face and starting to put together a plan to start generating some momentum for walkability in your community. So if you're advocacy minded, I strongly recommend doing that. Find that place that's not so great and start organizing around that.
Thank you, Mike. Your turn, Rachel. What do we need to do to start this in our community?
Specifically to walk with a doc, we need a healthcare champion and a place to walk. So reach out to us, contact@walkwithadoc.org, and we will help to get that started. And just outside of Walk with a Doc, by way of movement, there are a lot of groups out there moving, passionate about creating safe places to move. Find them in your community and help elevate those voices, because the more we can work together, the more we can change the space and make things more accessible for everyone.
Great. Thank you. David, this next one's for you. What's the easiest way to get older adults into walking? With my relatives, I've found that if they've never exercised, it's hard to change their minds and encourage them that they can.
Well, that's interesting. Nature walks has been something that has worked. I know people have tried in getting people out to go to the park and just to look at the leaves and the birds and just do it as a family outing as well. I think if you can get the kids involved and people family members to come and do something together. But I think, we showed slides that really listed so many of the benefits associated with walking. That if you can convince them that it really is good for your health and it's a low impact way of helping yourself, that it's important. We were designed as humans to walk. We were designed to move. That's how we're built. And unfortunately, we've gotten used to driving everywhere and riding everywhere. But if you can encourage them to do something for themselves and their health, and that this is one of the easiest ways to do that, and that walking really supports not only physical but mental benefits, and can be a fun thing to do, with family and friends, that might be a good way to start the process.
Great. Thank you. This question is tagged for Rachel and David. Do walking programs continue through the winter? Are there any initiatives to maintain the social and health benefits year-round in cold places?
Rachel, you want to take that first?
Sure. By way of Walk with a Doc, again, depends on the community, but oftentimes if the weather is not conducive, be it Texas in the summer or a really blistering cold place in the winter, we encourage walk chapters to establish an indoor location where and if at all possible, so that programming can continue to happen.
Yeah, one of the things that we do is that we use the mall to actually walk. In Columbia, where I live, we have a mall, and there are mall walkers during the wintertime. They open the mall up early, probably around 6:30 in the morning, and we normally get there in the wintertime, probably around 8:39. Before the mall opens, which is usually at 10 or 11. I think it changes throughout the year. But the malls are a very good indoor place to try to walk during the wintertime. And most of them will support that if, if you come and ask them about it or inquire. But being able to walk indoors in an area is something that you can do, and it is advantageous.
Thank you. This one looks like it go for anybody. Achieving great walkability in semi-rural communities without the buzzword density is challenging. Any suggestions?
I'll jump in. Achieving great walkability in an urban community without the word density is challenging. So let's just acknowledge that, yeah, there's something about that word and that conjures images up of, there's a lot of cultural things freighted with that it's it'll be, I've even had this in my neighborhood where people said our neighborhood business district was the unsafe place, even though it's just looks like the center of any small town around. I think one way, obviously is language, a traditional town design, I think is a good phrase that can we return to a traditional town design or a traditional way of building our places, the ones that was tried and true and worked so well over the years, I think can help. I personally, over the last couple of decades, almost never use the word density because density isn't the object, isn't the objective here. The objective is housing or the ability to get around or a walkable community. So we've also heard the phrase infill. I don't know how that one measures in polling, but urban infill is a phrase that's been used for a while. Maybe get rid of the urban and just say infill. But I would just say, building housing close to where people need it matters. I mean, I went to a conference. I don't have to say where, but I went to a conference one time that was in some old mill buildings in the downtown. It was great old mill facilities downtown of a traditional old town in New England. And but I was out staying at a motel, and I'm kind of past the edge of town, a couple of miles away, that was next to the freeway, and right next to it were all the medical facilities. And I was like, wow, people in the town, gonna have to drive to get to the medical facility here. So I think just really trying to focus on trying to put things in close proximity to each other would really matter. And I think if state and local laws made it easier to do so, that medical facility was probably located on the perimeter because it had a requirement of X number of parking spaces. So you got to find a green space. I think we've seen the same thing with schools. So yeah, don't use the word density, but just say we would like people living in town and we would like people to be able to walk where they go. I think many small towns across the country, by the way, I'm in Seattle, but I got two kids in Montana. I spend my time checking out Western towns. I get off the highway and take the business route pretty frequently when I'm making those long trips. There's a lot of traditional downtowns across the country in very rural communities that would benefit, and many do benefit from just trying to locate their civic institutions and really promoting the business climate within the town, and then make it easier to build housing. So you develop the customer base for those types of businesses. Sorry for the long answer, but yeah, don't use density. Talk about the benefits to people.
Thank you, Mike. Any other thoughts on that question from our other panelists? There's a question here about AICP credits. Yes, I don't have the number in front of me. It is in the presentation which you will receive. I can read the number again. And then I have a couple questions that I'm asked, but I'm going to get to this one first since it was asked. What is
No, if
that?
I could, before
Yeah,
you do
yeah.
that, if I just wanted to add one more thing to the last
Hey.
answer, I just want to say that particularly in rural communities, your Main Street business community, there'll be a mix of views within that community. Some will think that the availability of parking is really huge, but there's a lot of others who are going to be for streetscape improvements or for reducing permitting challenges for new businesses. Um, some will be, happy. We've seen a lot of small towns get rid of parking minimums because somebody wanted to open a hardware store, but they couldn't because they couldn't get 10 parking spaces for their new store. So really think about, and in a more rural community, that Main Street business community really matters to local elected officials, as well as, of course, the residents of the town. So anything you can do to kind of focus on that kind of affordability and the promotion of local businesses is a great way to start. And I've seen again lots of small towns doing this, and a really great organization, not here today, is Main Street America. And I really encourage you to take a look at what they do. And there's oftentimes grant money available, both from public and private sources, around how to increase the walkability of your traditional Main Street, which may be pretty damaged, over the years. But there's a lot of resources out there for that. So check out Main Street America and think about your local business community. Not the people from out of town who own the Walmart, but the people in town who are, try to make it go. They can be great allies for improving streetscapes downtown and making it a more attractive place for walkability.
Thank you, Mike. There's a question about getting certificates for non-AICP credits. Not exactly sure what PTP is, which was asked. So my colleague will be sending certificates of completion for this Walkinar to everybody who attended. That will confirm that you did attend. But the only, I guess, official credits that this earns, at least that I'm aware of, are the AICP credits. And thank you, Francine, for putting the number in there. Mike, I do have a follow-up question with you. And you might have mentioned this before, and I apologize if you did. I've been monitoring a lot of things here. You know, in Maryland and across the country, the idea of getting rid of parking minimums is a difficult one for a lot of folks to embrace. But your experience from everything from a community organizer to a mayor of Seattle, what was the secret sauce in convincing residents, stakeholders, and officials that reducing park or getting rid of parking minimums was the way to go? How did that discussion unfold?
Yeah, so I'm the promoter another organization here, the Parking Reform Network, which has great talking points. Another place called Sightline.org has great talking points. I think the places where you've seen these changes, I'll characterize in a couple of different places. One is, I think, in the places where there's been really large housing demand and not enough housing. And so parking reform kind of becomes part of how can we make it easier to build, housing where people, want it. So, for example, a backyard cottage, oftentimes, a community will go, well, every backyard cottage needs one parking space or something like that. If you can get rid of that requirement, maybe you can get that backyard cottage, which gets somebody in there. Or it's amazing how much parking requirements drive the size of the building or what the building is like. So, for example, if you have a small lot and you have to have 8 parking spaces or whatever, that's going to drive the entire design of the building. You may only be able to fit 4 parking spaces on that lot, so you're going to have 4 units. If you get rid of the parking spaces, you might be able to have 8 or 10 units. So if you're in a place with really high housing demand, that can be a successful argument. The other place I think I've seen it in a fair bit is, in fact, in these smaller cities, which have had challenges with the economic vitality of their downtowns because of the big box store, or just because they're not a growing high demand city. And those are the other types of places I think you can see where if you go to Parking Reform Network and see where parking minimums have been eliminated. So it's not necessarily a blue or a red issue, if you're looking at it through that lens. You can find a lot of places find that it's not that you're eliminating parking, it's that you're giving businesses the freedom to choose how much parking they need for their business and to compete on the quality of their business. And, I gave the hardware store example earlier. And that was a real example to me as a mayor of Seattle. A guy came to me and said, I want to open a hardware store in a dense neighborhood, but there's no way I can find a parking lot for the parking minimum under the rules. And my thought was, and I think this happens now in a lot of places, it's like, hey, if he wants to open a hardware store without parking and he can make a go of it, why are we standing in the way of a local businessman who thinks he can make something happen? Right? Why are we putting this requirement in that makes our place less walkable? And it's been really successful in places that have eliminated it. It's been really successful. So I would, really take a look at what your location is and what the argument is. It is a challenge because there are people nearby and finding parking is hard. I get it, and it's like, well, where will I park if all this new people come in with their cars? Like, what do we do with all the cars is oftentimes the argument you have to face. And if you can shift the argument from what are we going to do with all the cars, if you're arguing over there, you're going to have a hard time. If you can shift the argument of what do we have to do to get more housing or make it easier for a local business to operate or actually have a streetscape with businesses next to each other, not separated by huge parking lots, just got to shift the argument to how do we create a place that really speaks to what we need locally in our community. It's working. I've been pleasantly surprised. When I was mayor of Seattle, I felt like we were a leader on reducing parking minimums around the city. Now Seattle's way behind what people are doing around the country in terms of eliminating a minimum. So highly recommend that.
Thank you, Mike. I have a few follow-on questions I'm going to get to here in a second. But I did want to say somebody else suggested Congress for New Urbanism as a resource for walkable city design. I know, Mike, earlier you mentioned Urban Threes land use value study. We have one done in our backyard just last year for the Eastern Shore. I put a link to that study. Similar objectives and findings to what Mike shared earlier. So I put a link in there. A lot of folks are putting some good resources in the chat, so I encourage folks to look at those. There was a question in the chat, and I'm going to pull out one part of it that I think would be very interesting to hear from the panel. When we're making development decisions, planning decisions, approval decisions, how can we quantify health benefits in a way that they're accounted for in that decision making?
Oh my God. I'm sorry. I'll let other people jump in here after I go. I'll try to be really quick. Right now, almost always most land use decisions are focused on, most transportation decisions are focused on how do you do on travel time? Does this reduce congestion, improve travel time? And they use models for that. Those slides I showed at the beginning that showed the impacts of health, those impacts can be modeled just as easily as those alleged time savings. By the way, they're kind of bogus. It only measures how fast people go on that road from point to point. It doesn't measure all of the negativity to people going in other directions. And it never stands up to time. Like usually the alleged time savings then materialize because more cars show up and it's just as congested. But you can model those health impacts and do that. We have a couple of webinars on that. We'll try to toss that into the chat. And there have been metropolitan planning organizations that have modeled different land use and transportation plans to see what effect it has. It hasn't, I can't really come up with a tool that'll deliver it to you, say, for a local street improvement or something like that. But at that larger scale, that exists. So yeah, it's a question of what are we going to prioritize? And I think there's a bigger political challenge here, which is oftentimes elected and local leaders and DOT leaders are so focused on the metric of how many cars and how fast that they're not actually answering are there other ways for people to get around, nor are they measuring what are the health impacts of what they're doing in a way that gives you a dollars and cents comparison. By the way, the health impacts of investing in a more walk bike transit center system over an auto-centric system, the dollars and cents of the health impacts usually way outweigh the alleged time savings from a new roadway. But it's just, you got to get the decision makers to do it first. If they're committed to doing it, there are tools for them to do it.
Great. Thank you, Mike. It looks like we've struck a chord a little bit with the parking discussion. We have a couple more questions about that. I see you're typing an answer to one, Mike. I'm going to come back to those. I have a question for David. I was involved in Maryland's accessory dwelling unit policy task force a few years ago, and we had a representative from AARP on the task force who's a big proponent of accessory dwelling units as a land use to support retired individuals in Maryland. So I'm interested in your thoughts, David, either your thoughts or AARP's about this connection between land use and walkability, particularly for retired individuals in Maryland or elsewhere. What land use, development decisions, type of housing, how do you see them connected from that perspective?
Well, you probably were talking to people from the national office who were involved in this versus the state office. But I think, just my personal opinion, obviously, walkability becomes very, very important, and the use of land to promote that for seniors and senior living, obviously is very important. Certainly from AARP's perspective, because our focus is really on the 50 plus and what tends to work, what tends to be ideally suited for them. I mean, that would be, I have had no involvement in anything like this or have really been engaged in that, but I see that as being something that I could see where there would be an interest there on how land is used moving forward, because there are a lot of dwellings and residents that are coming up, that are focusing on senior living. I guess that's where the tie-in is probably how it's effectively used to support that side of the equation. If that answers the question.
Thank you, Dave. All right, back to parking. Oh, sorry, go ahead.
Oh, no, I was actually, you were getting ready to go to parking. I was going to ask a different question, actually, something, of Mike around the walking college I'm very interested because it was something I was involved in 6 years ago. And I'm curious about how it's evolved, and because it was the college, I always remember how it was designed to help us really develop people and advocates, if you will, for complete streets policy and those areas. But I'm curious where it is now and what the mission of the college tends to be.
Yeah, so the mission, I think, remains essentially the same, which is to bring people in. It's not meant to be just at the beginning. We like people who've maybe struggled a little bit with the issues, in their own community, but it's to really uh, both the knowledge of what walkability is, why it matters, the tools to achieve it, plus some tools to think about how can you get your community engaged. So I think, and that's what you described. So I don't think we've really changed it in that regard, what it's trying to do. We have made a couple of changes though. One is, and we're always updating the curriculum, but around that core mission. But one of the changes is we really encourage we encourage people to come in 2 or 3 people from a community, because it can be awfully hard sometimes to be an alone person, right, without some help. But if you get 2 or 3 people, maybe they can maintain it. And we still have a walking action plan. Every graduate comes out with an idea of what do they want to achieve. And we're hopeful that if it's a 2 or 3 person team, then that's something that will have longer legs and viability in achieving. So I think that's one of the most significant changes we've made, is encouraging that. Um, and of course, as I said, we've tried to update our knowledge base of what is or is not effective, and brought in some more and different organizing principles. One of which is the idea, it's called "You Can Make a Difference," and one's personal story matters. So we teach a lot about that. And David, you're just such an awesome example of both of those. Like you wove in not just why it matters from a technical perspective, like I mainly did. You wove in from the personal perspective, because what we know is that people learn both with the head and with the heart. And you were touching people's heart with your story, and that inspires people. And the fact that you've done so much inspires people as well. So we really try to teach people, if I can boil it down, how could they be leaders like David is what we're trying to teach them right now, because you got it figured out. So, and there's tried and true learned organizing isn't just something that you have or you don't have. It's a little bit more like having handles in basketball. Practice makes you better. So the more you work with other people, the better you get at it. And there's a lot you can learn from people that have done it before you to shortcut it and not have to do it all by trial and error, which is how most of us learn how to organize. But
Yeah.
all of us can be organizers. If you've ever gotten a dozen people to agree, or if you've ever gotten four people to agree on a place for dinner, you're an organizer. If you've ever gotten your kids out to kids out to school out on time, you're an organizer. But now, how do you start translating those skills into a more public realm?
Right. Thank you.
All right, one more question about parking, then I'm going to wrap it up with a conclusion and looking forward to the rest of Walktober. What is the role of shared parking, and what is the role of Park Once districts? I've never heard of Park Once districts, so I'm interested to learn that myself. But we'll start with shared parking.
Well, I think the role of shared parking, and you can do this within a community. In fact, thank you for asking the question. One of the really great places to start with the parking discussion is people start when they hear that you're going to eliminate parking minimums. People might think, oh, you're going to get rid of something that's important. Parking is important. You're going to get rid of it. So the first question is, well, actually, how important is it to the district? So really, one of the best things that can be done is a parking study, which is literally just people out there with clipboards measuring how many people are parking in the neighborhood at any given time and also measuring the private park, not just the public parking spaces, but the private parking spaces, right? So what a lot of communities discover is that their parking minimums are way overboard. Like there's just not actually that demand there. If you're demanding 50 spaces for this business and they're regularly only using 20, we also oftentimes demand that it be for the biggest demand day of the year, Black Friday. Well, Black Friday's now online, right? So a lot of these minimums are just very unscientific and very old. And so a parking study is a great place to start. And that parking study can probably identify opportunities for shared parking, which is obviously, um, you guys get most of your business during business hours on the weekdays, but maybe you got a little local theater company that can use your big parking lot at night. So are there examples where you can arrange deals? It can be very challenging because now you're dealing with private actors and dealing with this. Park Once districts, I think, is just the idea that once you get there, you don't have to drive again. And if we think of one of those really wide roads I showed, one of those wide roads I showed at the beginning, you know the place, right? Oh my God, I gotta cross the street to get to the other place, but I'm gonna drive. There's no way I'm gonna walk across a four-lane arterial, across a parking lot, a four-lane arterial, another parking lot. So really, Park Once districts is just your traditional downtown district. Like once you park, everything's within walking distance. So, and that's where I think, you know, before your community builds a big parking garage, or before it really invests in big parking minimums, how much parking is actually being used and needed on a given basis. Um, and maybe it's okay if a few days a year it's hard to get parking if you don't force everyone to overbuild. And then are there ways that maybe you can have some common facilities either shared amongst local businesses or by the city to help ease that? And you see that you'll see a small town that has a commercial parking lot maybe within walking distance of the downtown, that they make available to make it easier for all the small businesses to operate.
Thank you, Mike. I learned something myself. Okay. So thank you all for joining us. This includes our first Walkinar of Walktober 2025. I would like to offer deepest gratitude to Acting Secretary Biddle, Mike, Rachel, and David for their presentations and such an engaging discussion. Thank you to everyone who attended today and to Jessica, my colleague, who's our communications wizard, who helped make this event run so smoothly. The complete recording of today's webinar will be posted online. I think Francine was posted some information about the other Walkinars in the chat. When you exit today's webinar, you will be asked to participate in a short evaluation. Please take a few moments to provide your feedback so we can continue to improve the webinar experience. Don't forget to sign up for the remaining 4 Walkinars taking place each Thursday during Walktober and to visit the Maryland Department of Transportation's website, which provides other valuable information on statewide planning initiatives, planning tools, and educational opportunities, always at m.maryland.gov. We encourage you to visit the website to subscribe to updates to learn more about our upcoming programs. Next week's Walkinar, same time, same day, is about safety and designing walkable communities for all, featuring author Philip Langdon, within walking distance, creating livable communities for all, as well as MDOT's Candice Holford and State Highway Administration's Molly Porter and Shane Sarver, who will share about MDOT's work around safety for walking. Thank you again for joining us, and I hope you all have a great rest of your day and get a chance to walk a little bit. I know I will. So thank you, everybody.
Thank you.
Thank you.